One, two, oh, yeah. How's everybody doing today?
No, this is. Actually, I think I could do a quick introduction. Good morning, everybody. Can you hear me?
Yeah.
Oh, good. Good. I told him he needs to make sure he uses the microphone today. I'm gonna stand on my tiptoes for a minute, so I'm gonna do this quick before I fall. This is Jason. Jason is with XL Audiology. He's going to be discussing hearing loss. He's also going to come back this week and do hearing aid cleanings for free. So if you or anyone you know is in need of that service, he will be here on Friday. I'm going to turn it over to him. Okay? Thank you.
All right, guys, how you doing? Like she said, my name is Jason Rickman. I'm a doctor of audiology. I've been an audiologist in Wilmington for 6 years now. I just recently opened up my own practice, so I have more time to do things like this. Talks, educational talks, and hearing loss. Hearing loss is something I'm pretty passionate about, and it's, I think it's something that's very misunderstood. A lot of people are kind of reluctant to get tested and to find out if they have hearing loss. And I think a big part of that is a lot of people don't know what to expect, or they don't know what comes of a hearing test. So I think a big part of it is just educating and letting people know the importance of it and to stay on top of it, especially as you get older. Hearing loss is going to become more prevalent. And I like this to be a little interactive too. So if you guys have questions along the way, please just raise your hand and ask questions. And we can make it a little bit more interactive than you guys just talking and lecturing to you. Okay. In the slides here, some of the stuff I like to cover today is the causes and types of hearing loss. What are some common signs and complaints of hearing loss? The latest research on it, and then advanced treatment methods, depending on what the hearing loss is and how can we help it, how can we treat it, and what can we do about it, okay? All right, so hearing loss is very prevalent. So in the United States, there's about probably 330 million people, and about 38 million people have hearing loss in it. So it's a good chunk of people. 40 to 50% of those over the age of 75 suffer from some sort of hearing loss, and 466 million people worldwide have some kind of meaningful hearing loss. So it's something that's very prevalent, and especially as our population ages, it becomes more aware and more people are developing it. So it is something that's worldwide, and it's something that, something to keep an eye on. Now, here's some other strong facts when it comes to hearing loss. So men are 2 times more likely to develop hearing loss than women. I think a big part of that has to do with the occupation men are typically in, especially years ago. Typically men working for blue-collar jobs, so things like construction work, maybe even in the military as well, pretty much male-dominated. That's changing, of course, as time goes on, but definitely if you go back 30, 40 years ago, the military is very male-dominated. So hearing loss is strongly correlated to things like noise exposure. So if you have worked around a lot of noise or had a career being exposed to loud noise, it's going to be something that you'll see hearing loss develop later in your life. Hearing loss is not something that always happens instantaneously. It's something that's a slow progression over time, and it's something that, you won't wake up one day with a hearing loss. It's going to be a very gradual decline over the years, which I think it makes people harder to know when they have a hearing loss because it's such a gradual decline. Here's another fun fact. 1 in 6 children in the United States have hearing loss due to noise exposure. So, when you see kids walking around with headphones, things like playing loud music, they're doing damage. And, some of that they'll see when they're younger, but they're definitely going to see it when they're older. When they get in their 50s and 60s, a lot of that loud music is going to hit them later in life. 45 million Americans struggle with something called tinnitus or tinnitus. Does anybody know, or does anybody have ringing in their ears? Ringing in the ears, anybody? well, that's a good thing. So when I asked this question a couple months ago when I was giving a presentation, I went on about tinnitus for a couple minutes, and somebody raised their hand and asked what tinnitus was. So tinnitus is some kind of ringing in the ears. So some people hear a ringing, a buzzing, a humming, something that's a constant noise in your ear, and a lot of the times that's a sign of hearing damage. So if you know somebody complains of ringing in the ears, then there could be some kind of hearing loss present or there. Some ringing is normal, so if you guys ever been to a loud restaurant or a loud bar and you walked out, your ears started ringing, that's normal. That's a temporary tinnitus, but there are more permanent kinds where it won't go away, and typically that's indicative of noise exposure. And about 30 million US adults can benefit from something like hearing aids or amplification to treat hearing loss. Okay, so on the next slide here, I kind of go over some of the causes of hearing loss. So like I mentioned earlier, the natural aging process is probably the biggest cause of developing hearing loss. So it's something called presbycusis, where it's hearing loss from getting older. So as we get older, we typically lose our high frequency hearing. Everybody's different and it depends on the degree, but as we get older, we do start developing that high frequency hearing loss. And of course, other things play a role in that. That's the next category, so this is genetics. So if you have a family history of hearing loss, a lot of the times that can tie into developing hearing loss later in life. So if it runs in the family, it's even more important to kind of stay on top of it and get tested as you get older. And as I mentioned before, noise exposure is a huge thing. So, and it does, like I said, it doesn't have to be noise exposure that happened recently. If you were exposed to loud noise in your 20s, it's going to hit you later in life. That's how hearing loss works. It's going to be something you'll see in your 50s, 60s, 70s, where hearing loss pretty much typically comes on as you get older. Reactions to medications. So there's some medications, not a lot, but that can cause hearing loss, especially in high doses. So if you guys ever known somebody who's on an antibiotic called the gentamicin family, so heavy antibiotics that they might give you in a hospital for severe infections, if it's not monitored, it can cause some hearing loss. And typically your doctor will take extra steps and dosages to make sure it doesn't cause permanent hearing loss, but things like that can cause it. Even some over-the-counter stuff in high doses can cause hearing loss. So I remember when I was in grad school years ago, I had a pharmacy professor, and she was a pharmacist for 30 years, and she told us they used to tell people when they went in to get their medications to take aspirin until their ears started ringing. And what was happening is that people were overdosing on aspirin, and it caused permanent damage. So that's why you always have to be careful to follow regular dosage when you're taking medications, because it can cause things like that as well. And then ear infections. So if you or somebody else know of a kid growing up who had a lot of ear infections or had tubes in the ear, if it's not managed appropriately, you'll see some permanent damage later on as well. Okay. Next, I kind of go into some of the types of hearing loss that you'll see out there. So when you go in and get tested for hearing, there's really 3 types of hearing losses you can have. So the most common one is called a sensory neural hearing loss. So we call that a permanent hearing loss. So that's about 90% of the people I see on a daily basis. It's people who have hearing loss from getting older. It's from genetics. It's from noise exposure. It's just kind of comes on over time. And that's just related to the age-related process as well. But sensory neural hearing loss is the most common. And then we have something called a conductive hearing loss, where there's some kind of damage to the ear. So like I mentioned, if somebody has an ear infection, or maybe they got a hole in their eardrum for some reason, it can cause a conductive hearing loss, where maybe you need to see an ear, nose, and throat doctor to get fixed, repaired. It's just something that's physically wrong with the ear, not so much permanent loss. And then, of course, you can have a mixture of the two. We call that a mixed hearing loss. So where you have a combination of a permanent loss and a conductive loss, where you have 2 things going on, which leads to that mixed component there. But like I said, the most common thing we see is that permanent hearing loss. And there's really not a surgery for that or a medication for it. There's no cure for permanent hearing loss. A lot of times you have to look at things like hearing aids or cochlear implants if it's severe enough in order to get treatment for things like that. Okay, so the next slide, I kind of just showed a diagram of the ear, kind of showing you the different anatomy parts of it. And that's where it will present differently depending on where the hearing loss is what part of the ear is being damaged or is causing the problem. On the next slide, this is, a lot of patients will ask me, what are some first signs of hearing loss? How do I know if I have a hearing loss? Or how do I know if my spouse has a hearing loss? And I can say probably the biggest thing people say to me is that they kind of notice something I call it a sound lapse, where they say, I can hear just fine, but I can't understand people. Or it sounds like people are mumbling, or they're not clear. So they know somebody's talking, but they're not getting the clarity in their words. So I call that a sound lapse. And what that is when your hearing loss presents a certain way, it affects certain frequencies. So if a certain frequency, like a high frequency range is affected, you're not going to hear some high frequency sounds in our words. So you're going to get a part of the word. And then that requires you to try to figure out what's the other half of the word, which makes that clarity an issue. So a lot of patients I see have something called a high frequency hearing loss, because that's pretty common as we get older. And they'll complain, it sounds like people are mumbling. I don't have a hearing problem, I have a clarity problem. And a lot of the time that's where it presents in those certain frequencies, which makes it seem like people are mumbling or just not clear. Some other scenarios I listed on this slide here. So another big one I get is I have a hard time hearing in noisy places. So like restaurants or anything where there's competing noises, you'll notice more a difficult time understanding versus a quiet one-on-one situation. Hearing the grandkids too. So, especially if they're younger, they have high-pitched voices, they talk fast. And if you have a high-frequency hearing loss, like a lot of people do as we get older, hearing those high-pitched grandchildren's voices is going to be very difficult to understand. And like I said, especially if they're talking fast. Trouble hearing on the phone. And then another big thing is the TV. So if you have family members or kids coming over, and they can't sit in the same room as you because the TV's on, that's a sign of some kind of hearing damage. And a lot of times people don't realize it because that TV volume will creep up over the years and you don't really notice it. And usually it takes somebody else to kind of see it in the house in order to realize, okay, this is getting a little bit too loud for everybody. So those are just some common scenarios people will see when it comes to early signs of hearing loss. So what are some symptoms that you might have where, I need to get checked out right away? So when do I need to see a doctor right away when it comes to hearing issues? So if you have some kind of sudden decrease in hearing, so if you wake up one morning and you can't hear out of one ear, go get checked out. The best case scenario, you just got maybe some wax in the ear or something like that. Worst case, maybe you had some kind of virus in the ear that needs to be medically treated. So anytime you have a sudden loss like that, it's always worth getting checked out right away. Doing it earlier is better than doing it later. If there's a big difference between your ears, so if over the years you notice my right ear keeps getting worse and my left ear staying the same, that's a concern. So typically as we age, we want to see the hearing come down together because your ears are born on the same day, they should stay the same. And if they're not, there could be some other medical issues going on causing that. And of course, some obvious pain, drainage, or fluid draining from the ears, obvious signs like that, always a good idea to call up your doctor to get checked. Okay, so when we talk about hearing loss, a lot of people think it's only involving, me hearing my kids, me hearing my family members. There's a lot of health components to hearing loss as well. I'll have patients come in and say, I don't really care to hear my family. I don't really care to hear the TV at a low volume. Yes, that's kind of a personal choice, but there's also an overall health aspect when it comes to our hearing. So probably one of the biggest aspects that's come out of recently is hearing loss as it relates to dementia. So they've done a lot of research on dementia over the last 10, 15 years because it's becoming more prevalent. And hearing loss is becoming a big cofactor for things like cognitive decline or dementia as we get older. I kind of talk about it a little bit more further on in the slideshow, but there is strong correlations between the two. Things like ringing in the ears, as I mentioned before, is strongly tied to hearing loss. Safety and balance is also another big one. So in our inner ear, called the cochlea, there's one side for hearing and one side for balance. So one of the biggest arguments to get Medicare to cover things like hearing aids is that if you have hearing loss, you're more likely to fall. And there's studies that show that. So our balance system and our hearing system are strongly tied together. So One of the biggest costs for Medicare in older patients is falls, because falls will lead to hip fractures, it leads to MRIs, it leads to surgeries, it can even lead to death if the fall is bad enough. So it costs our government and our Medicare system tons of money to treat falls. So hearing being strongly tied to balance and falls, it's another strong component to be like, okay, if we have a hearing loss, we're more likely to fall. Let's get that taken care of. Let's stay on top of it so we're not putting ourselves in that kind of situation. Things like diabetes as well. It's always been known hearing loss has a strong connection to diabetes. The CDC just actually about a month ago made it a requirement that if your primary care doctor, if you're pre-diabetic or diabetic, they recommend getting a hearing test. So if you're pre-diabetic, you're 20% more likely to have a hearing loss. And like I said, it's always been known, but they're putting more regulations in now that, if you are diabetic, it does affect your hearing. And it's one thing you kind of want to watch out for. Isolation is a big one when it comes to hearing loss. So when you can't hear and you can't participate, you tend to pull back from conversations. Most people do. And isolation it can also lead to things like dementia as you get older because you're not interacting the way you should. So if you notice somebody who doesn't want to participate or doesn't go to events because they're afraid they're not going to be able to follow the conversation, that's going to play a big role in their quality of life. So things like that is always a reason why you want to stay on top of hearing. In the next couple of slides, I kind of go a little bit deeper into dementia. So there's been a number of studies, like I said, when it comes to hearing loss and dementia. The first study came out in 2014 out of Johns Hopkins. And they looked at a whole bunch of people and they were trying to figure out what are some cofactors for things like dementia. And hearing loss kind of played a big role in that. And then as recently as 2017 and 19, a Lancet study, which is a medical journal, they did another study in dementia. And they were looking at, okay, we know all these factors that play a role in developing dementia. What are some factors we can actually adjust and change to prevent it? And hearing loss was actually the largest preventable factor when it comes to dementia as we get older. So it was about an 8 or 9% factor that if you have hearing loss and you treat it, you could potentially drop dementia 8-9% the chance of developing it, which is pretty huge. And that came behind smoking, depression, isolation, other factors you can try to change, but it was pretty big when it came out in the field. And here's some other simple facts when it comes to hearing loss. 1 in 3 people over the age of 65 have hearing loss. 8 out of 10 say hearing aids increase their quality of life. So in the next couple of slides, I kind of just go over some things you should expect when you go to get your hearing tested. So when patients come to my office, the first test we do is we go over your history. We go over any background you might have to determine, okay, are you at a chance for developing hearing loss? And then we'll look in your ears. So we want to make sure the ear looks clear. There's no wax, there's no debris, there's no holes in the eardrum, there's no fluid in the ear. Make sure all that looks good. We'll run a test called tympanometry where it will test the pressure of the eardrum to make sure that's functioning okay. And then we do the old-fashioned, raise your hand or click a button when you hear a beep. So we've been testing hearing that way for 40, 50 years. There's really not a better way to do it. So you kind of do the old-fashioned raise your hand when you hear a beep test. And then as of more recently, we do a lot of speech testing. So, some people can hear beeps just fine, but how do you do with words and understanding words? How do you do in background noise? So we kind of go out, we kind of do some extra testing and say, okay, if you hear fine and quiet, how well do you do when there's competing noises going on? So we'll test that as well to kind of see your capabilities there. Another big thing I get from, talking about hearing loss is hearing aids. Hearing aids are becoming more prevalent. There's tons of different types of hearing aids out there now, all different kinds of technology. And I kind of just list a few of the advanced stuff you'll see nowadays. So things like artificial intelligence. So hearing aids, they're little computers that sit on your ear. They'll analyze your environment. They'll make changes automatically for you. So they're not the big bulky things people remember them to be that whistle all the time. They're little computers nowadays, kind of like how your iPhone or your cell phone or your computer, they're miniaturized and they're computerized. So they're very adjustable. They handle background noise. They change automatically in all different kinds of environments. Some of the big changes lately, they can be rechargeable, so you don't have to change little batteries on them anymore if you don't want to. They've come a long way over the years. So I kind of just go over, when you're looking to get your hearing tested, just make sure you get it, you want to get a thorough test. You want to make sure you can trust the person that you're getting tested by. Make sure you feel comfortable with them. Make sure they go over all the testing. You know, if the testing's taking 5 minutes, you're probably not getting a too thorough of a test. So make sure they're doing all those things I mentioned, the speech testing, the word testing, the old-fashioned beep test. You want to get the overall picture of what your hearing system looks like. So when we look at treating hearing loss, we want to improve independence, be more socially engaging, and improve safety from balance reasons, and to reconnect with loved ones and have conversations without having to ask what all the time. So one of the biggest questions I like to ask when I come in to talk to people, especially when we're around that age range where we start seeing hearing loss, is what do you guys think is the most common mistake people make when it comes to hearing? Anybody? Most common mistake that you think people make? Yeah. Okay. Yeah, so maybe they're reluctant. So she said maybe they don't want people to know that they can't hear. So maybe they're a little bit reluctant about it or embarrassed to find out if they have a hearing loss. Yeah. I would say after all the patients I see on a daily basis, I would say a lot of people ignore it. And maybe that's because they're embarrassed, or maybe that's because they don't want to know if they have an issue. But ignoring hearing loss is probably one of the biggest things. So in the United States, about 20% of the people who can wear hearing aids actually wear them or get them. So it's a very low percentage of people who have a hearing loss and can benefit from wearing hearing aids actually get them. And there's lots of reasons for that. But I guess why do you guys think that is? Why do you think the fitting rate is so low when it comes to treating hearing loss? Any idea or guesses? I don't know. I always like to ask this question because people they do research studies trying to figure out why only 20% of people actually get help. Right. Yeah, so cost is a big thing. Hearing aids are not inexpensive. There's a cost barrier to that. I definitely think that. I think stigma plays a role in that as well. I think there comes a long way to developing to get over the fact that we have a hearing loss. So price is probably the biggest thing I hear when I give talks like this and I ask this question. One thing interesting when it comes to price too, and they've done a number of studies on this. When they looked at countries like the UK and Australia where you can actually get hearing aids through their medical system for free. They have socialized medicine there. And when we look at the UK, which if you need a hearing aid, you can go in and get one. It doesn't cost you a thing. Their fitting rate's about 27%. So in the United States, we're about 20. The UK is about 27. So there's a difference there, but it's not a significant difference. So I think that's what's been puzzling people in that, okay, why don't people want to do something about their hearing? I think cost is a factor, but I think there's some other stigma that's really preventing people from actually taking that step, because ideally we want an 80% rate, we want a 90% rate. So we kind of look at all that stuff. Yeah, do you have a question?
Maybe they're afraid, like I'm saying, maybe they feel that's a sign of old age, and I like to ask a question. I want to revisit something that you said. You said something about a cochlear implant, as in fact it's a permanent hearing loss. Okay, other than the fact that the person might have dementia, once you ask them if they want that implant, that's surgery. Would you advise them to take something else to hear, ASL, or something before it's totally deaf?
Good question. Yeah, that's a great question. So I always get a cochlear implant question too. So when it comes to cochlear implants and hearing aids, so if we have a permanent hearing loss and we know we can't get a surgery, or I shouldn't say surgery, we know we can't physically fix it, right? We can't do a surgery, fix the cochlea or the bones and correct it. And we know it's a permanent loss, and we either A, need hearing aids, or B, need to do something like a cochlear implant. So when you need a cochlear implant, they have to determine that hearing aids don't help you anymore. So a cochlear implant is only an option when hearing aids aren't effective. So when a hearing loss gets so severe that you get no benefit from a hearing aid, that's when they look at doing cochlear implant testing. So, and it's a personal choice. So yes, there are other options. So if you get to the point where, you know, the hearing aid's not helping much anymore, you can decide, okay, do I want to undergo the surgery? Do I want to go through that whole process? You know, as you get older, it's a harder decision. You know, if I have a patient who's in their 90s and they're determining, okay, the hearing aid's not helping much, but do I want to undergo that major surgery when I'm 90 years old? Of course, they have to talk to their doctors about it. You have to get the opinion of the surgeon. And all that plays a role, but you kind of have to balance the two. When it comes to cochlear implants in children, it's amazing. You know, kids nowadays who are born, you know, completely deaf, they can get a cochlear implant by 6 months of age and grow up in normal schools hearing like other kids. And for little children, cochlear implants is like a miracle because they grow up learning to hear with it. And they're able to engage and go throughout life, you know, as they would, versus learning sign language. Now, it is a personal choice because being deaf, it's almost like a culture as well. So it's called capital D deaf. And it's a culture, you know, people identify as being deaf as not being a disability, but as a part of them, you know. So, you know, when as an audiologist and going through grad school, we're trained to talk to parents that way because the parents have to decide, do I want to go the mainstream route, get them a cochlear implant and go through regular school, or are we going to go through ASL, American Sign Language, and go, you know, that direction? And it's a big choice parents have to make. But either one is an option for kids or adults. Does that kind of answer your question?
Yeah, yeah, somewhat, yeah.
Okay.
Yeah,
What?
and, no, I'm just wondering, you know, I didn't hear it at first. Oh, you're totally deaf. Do you want surgery or do you want ASL? That's what I. If I'm a certain age, no, I don't want the surgery. ASL is fine, you know?
Yeah.
But, it was something else that you said?
Yeah.
You were going about, you were talking about the off balance. The one side, you don't want the balance, okay? Isn't it sort of like a equilibrium in there? I mean, the infection, I mean, at what point would you, how would you treat it? Just, not just 1 year, but 2 years, I mean, can you kind of guess what I'm trying to say with that? I mean, that's not the only thing that can throw off the balance.
Yes, so.
You know, you can wake up one morning and everything.
And the room's
There's a
spinning.
lot of people that are on medication for that. It's usually around spring or allergy time.
Yep.
But it's a true thing.
Yeah, you're absolutely right. So balance issues and vertigo, there's lots of vertigo. Yeah, so there's lots of causes of it. You know, so medications can cause it. Even something as simple as blood pressure, standing up too fast, you might feel a little bit off balance. So there's lots of different causes of it. But the balance system is in the inner ear. So when we're looking at the ear, it's like a duplex. One side's for hearing, one side's for balance. So if anybody's ever heard of having something called a crystal condition in the ear, where you have little crystals, which if you wake up in the morning and the room starts spinning, you might have went to the doctor for it. It can kind of move your head around to fix that issue. But all that's involved with the inner ear. So you have to figure out what's the cause of the off balanceness. So if you go to your doctor with the complaint of being dizzy all the time, they have to rule out what's causing it. Is it the new medication he just put you on? Is it something involving the ear where you need to go get balance testing to figure out, okay, the issue's in the inner ear? So there's lots of causes of it, but I think it surprises people to know that their balance system is strongly tied to their hearing. It's also our ability to localize sound. So if you have a hearing loss, it's very difficult, especially if one ear is worse than the other, to figure out where sounds are coming from. So, and that's going to affect you walking down the hall. So if you can't determine if the sound's coming from a certain direction, that's going to throw you off and you potentially can have a chance of falling from it. So the key thing is, it's like any other puzzle when it comes to our medical issues, is that you have to rule out things. So you want to rule out all the causes of it and figure out, okay, is this an inner ear issue? Is this a medication issue? Or is this, I had surgery on my knee, which is making me thrown off balance as well. So there's lots of causes of it, but the inner ear is a part of that organ.
Yeah, that's a strong, that I'm looking at how strong, I mean, most of the problems come from the inner ear. Wow.
I mean, It's more than people realize, you know, it's one of those things, it's not the only cause, but, you know, people think their ears are just for hearing, but there's a lot of other health aspects associated with it. You know, those are great questions. Yeah.
Is Medicare getting better about paying?
Thank you for your names. Great question. Yeah, I like when you guys ask me these questions, because these are the questions people want to know, you know, and this is a great opportunity to ask an audiologist without even having to go in for an appointment. So that's also one of the biggest questions I always get asked when people come in is, does Medicare cover hearing aids? And they don't currently. They never have, just like dental, just like vision. Now, there was talks of them trying to add things like hearing, vision, and dental as well. As of lately, they tried to get it added in that Build Back Better bill that Joe Biden was trying to get passed, which got delayed and kind of pushed off now. So in there, they were actually going to add coverage for hearing aids in Medicare. Now, they did have stipulations though. So you had to have a certain degree of hearing loss. So they said you had to have a severe to profound hearing loss. So if you had a degree that was less than that, you might not be eligible for coverage. And with the way the bill is standing right now, doesn't even look like it's going to even get passed. So as of right now, Medicare does not cover anything. Some secondary insurances might have some coverage. I tell patients, if cost is the main barrier, talk to your audiologist, because I have a lot of programs I work with that we can try to get you help within those programs at a little to no cost. So there are options for people, especially if you feel like you're stuck. If you feel like, you know, I just can't get a hearing aid because I can't afford it, there are options. There's a state program we can go through as well, where if you meet income qualifications, the state will provide a hearing aid. So there's lots of options out there. So I tell patients, don't be scared to go in because you're afraid of that. I know that's a big concern for a lot of people, because it's some hearing places you go, they'll make it seem like it's a sales pitch, you know, and that I think that's awful, and I don't think that's how it should be. So that's why I always tell people, make sure you're comfortable with the person you're seeing. If you feel uncomfortable, then just, you know, leave. But, you know, an audiologist should try to do everything they can to find you the help that you're trying to look for.
Do you have a practice here?
Yeah. I have some, I have a thing in my code I can give you, yeah. So, like I was telling people earlier, I've been an audiologist here for 6 years, and I recently opened up my own practice, and which, like I said, gives me time to do things like this, which I really do enjoy. You know? Great questions, guys. Does anybody have any other questions? No? All right, guys. Well, thank you so much for listening to me. I appreciate it. If, like I said, you guys have any questions, if you want any information from me, just come up and ask me, okay? Yeah.